Good afternoon. I'm Richard White. I'm the Chief of Surgical Oncology at the Levine Cancer Institute through Atrium Health here in Charlotte, North Carolina. So, Dr. Greene, I'm going to ask you a simple question. What are your most vivid memories from being on the CoC and being the chair of the CoC?
Well, Richard, first of all, it's just a delight to have you interview me. We've known each other for a couple of decades or more. I was CoC chair between 2004 and 2008, and it was an active time for the commission. I will preface that by saying my real love in the commission was always the accreditation program, the approvals program. I was always interested in the standards, and I chaired the accreditation committee for a number of years before being CoC chair. So when I took over as chair, one of the things I wanted to do was create sort of a strategy for bringing in new standards. And I think we effectively did that in 2004. We came out with a new manual of standards in 2006. Which I was very proud of. The other thing I tried to do is we always were based on structure and process, as you know, with our accreditation program, but we never dealt with outcomes. So what we did, we created the CP3R program in 2005. And we went to the National Quality Forum, and as you know, we took 4 breast cancer benchmarks to them. Later, we took some colon benchmarks. So that was a big item for me in the commission, and of course that has gone on to create the RCRS program and some other things that we've developed since then. Again, during that time, and I think you'll appreciate this with your American Cancer Society involvement, I really tried to push to get the CoC involved more with the American Cancer Society. I tried to make sure that our ACS representatives were involved in the surveys, which we called them at that time. We created a national group where the ACS representatives would be involved with us when we had surveyor meetings in Chicago. And then I got more involved with trying to get the ACS CAN group, again, which you're very familiar with, in advocacy to go in lockstep with what the CoC was doing. I actually chaired the first advocacy committee for the commission prior to being CoC chair. And so I tried to get American Cancer Society in lockstep with them. And then I think one of the other things I was proud of, I always was like the idea of the trauma group having a paper competition. So I got the CoC to start a paper competition for cancer. And we had our first paper presentation was at my last meeting as chair in 2008. So I think those are really a lot of the highlights for me as CoC chair.
And I would echo that. I think, Rick, you did an amazing job taking what was prior to that a process organization and really made it a much stronger quality organization. And all of us owe you a substantial debt of thanks for that. One of the other questions I'd like to ask you is, what's the role of the CoC now, and where should it play a role going forward?
Well, you know, I think there's so many components now of the commission. Again, I think our accreditation program is really one of the bright stars. We have about 1,540 programs in the commission. That's about 24% of all acute care hospitals. But as you well know, we take care of 70 to 75% of all cancer in that minority of hospitals in the country. And in the late 80s, when I first really became involved heavily in the commission with the NCDB starting, we now, of course, have 37, 38 million cases in the NCDB. So it's such a magnificent repository for clinical research. As a matter of fact, one of the things we're going to highlight in the 100th anniversary is to highlight the papers from NCDB data that have really revolutionized cancer care. So I think, again, accreditation committee is really played a role. I think it's really now that people understand that the commission is a multi-organization group made up of about 58 organizations. When I first became chair, we had 42 organizations. I brought in the NCC and network, for instance. I thought that was an important one to bring in during my time as president, as chair. So I think that now the public is starting to understand what the commission does. It's not a group of surgeons telling hospitals how to take care of cancer patients. It's the commission, which is made up of all of these wonderful organizations. So I think that's really the benefit. I personally would like to see going forward more public education about commission activities. I think that will be very important for us as a commission as well as the public.
Now, Rick, looking back, who were the people that really drove the commission in your career within the commission, above and beyond Rick Greene?
Well, of course, you know, the joy of working with the commission is the wonderful staff we have. And I can tell you that certainly from everyone that I've ever worked with who was in that Chicago office, and I started with the office in Erie Street, which was the older building. And we, of course, went into the new building. But I think if I was going to highlight individuals, certainly I would highlight David Winchester, David P. Winchester, who I first met Dave when I became involved on the national level of the American Cancer Society as a director in the early 80s. And Dave and I became friends. And then, of course, when he took over as director of the cancer department, that was real joy for me. So working with him all of these years has been really wonderful. I think also working with Connie Bura, who you well know. Connie's been there for a couple of decades or more, obviously, and it's been a joy.
Be careful with the or more.
No, she started when she was about 6 with the commission and the cancer programs. But I think, and certainly now working with Heidi Nelson, in her role, she's done a magnificent job, certainly recently. So I think there are so many people. Rosemary Clive, many of us remember, and Herman Menk, and many of the registrars who have been involved in the NCD program. It goes on and on.
Rick, one last question. Tell me the importance of the registrars in the Commission on Cancer process. I know you're a huge champion for the registrars and the registry.
No, I could talk for hours about that, as you know. No, I think I first got involved, by the way, in the commission through my work with the AJCC. And it was interesting because I was chair of the commission at the same time I was chair of the AJCC. But for me, it worked very well because it melded both organizations. So my work in the AJCC was due to my early work in laparoscopy, where I saw that the laparoscope could be something that we could stage intra-abdominal malignancy with that technique. So that's why I was invited to my first AJCC meeting. So my work with staging really dovetailed with my work knowing what registrars did. And again, it started with me as a resident. When I was a resident, I was at Yale, and we had the oldest state cancer registry in the country. So I got to work with the Connecticut State Registry when I was a resident in surgery, which is really a boon to me. So I understood what registrars did. So I think, again, with the NCDB and certainly with what my work has been for 24 years as a site visitor and a surveyor, I love working with cancer registrars and understanding what they do. And I really appreciated the fact that the National Cancer Registrars Association is a part of our commission.
That's terrific. Thank you, Rick.